The MLHP is a health provider with a very specific qualification. 3 categories of qualified individuals are permitted to apply for such a post. Number 1, you must be a BSc nursing with a bridge course of 6 months in community medicine or community works under the health department. It is a certified program of 6 months. The other one is the CHO, community health course that is run. Then the third qualification who can apply for these kinds of posts are these Ayush doctors who also have this certificate bridge course. Now this certificate bridge course runs in very specific institutions in the state of Meghalaya. One being the Negrims and the other one being the Woodland Hospital. However, there could also be individuals with these qualifications passed from recognized institution by the Nursing Organization of India. So, what happened in the selection procedure recently, in the recently conducted application that was called, was a campus recruitment in Negrims and Woodland. It was like a campus recruitment because these qualifications are specific for people having those qualifications. We kind of regret that we overlooked that maybe other people from other institutions could also be having similar qualifications. And hence, the department has engaged again and brought out an advertisement that will encompass and give opportunity to individuals who likely pass out of these 2 institutions. And this interview will be held in Tura on the 12th of September. We should give adequate opportunity to all. Though we know that in the state of Meghalaya, only 2 institutions, recognized institutions, run this program. So, like is done in several other, job recruitments. The Department of Health thought it would be best to do a campus recruitment here. But then, okay, we did that and that has been corrected, and this advertisement has been put on hold, and we have re-advertised the post so that we give equal opportunity for all Meghalayans to apply for this particular MLHP job. Another prerequisite of an MLHP should be knowledge of local language, because the MLHP is a health provider at that level of health intervention after a doctor, above a nurse. Say in some of our services already in the system, like your health centers, health and wellness center, we may not be able to provide a doctor because even in a CHC, PHC, civil hospital, we're not getting enough doctors and specialists. So Government of India, in its wisdom, has expanded the health system with the hope to reach population better. And these health services, wellness centers, are at the village level. In all probability, about 10 to 15. I'm not sure about the exact requirement or specifications under the scheme, but we should be able to have at least one such health provider with that kind of a qualification, which is a BSc nursing with a bridge course in MLHP. So, keeping in mind that these 2 institutions are operating in this region of the state, we feel it would also be fair that in future we must have such institutions also functioning in other parts of the state. Because now we realize that we will have to recruit a lot of such individuals to help us deliver quality health services to the public at the village level. We will have to ensure that we handhold people from all communities across the state. Wherever this gap is seen, to handhold them, likely I will also propose to the Honorable Chief Minister if we can have sponsored candidates. Let us sponsor candidates where these gaps occur. Because somebody from another part of the state to work permanently in another part of the state will be a challenging proposition. It is a practical proposition. Language is a prerequisite, because if I don't even understand the health problem of a citizen who comes to my wellness center, how will I commensurate the necessary health interventions? So we have assured these NGOs that okay, we have taken note that there is no such institution.